If you've ever had surgery or even just gotten a medical bill in the United States, you probably know the pain. And I'm not talking about physical pain. I'm talking about the pain in your wallet. Now, imagine paying 70 to 90% less and still getting high-quality care, experienced doctors, modern facilities, and personalized attention. Sounds crazy? Well, that's exactly what's happening in Turkey right now. In this video, we're doing a side-by-side breakdown of the cost of surgery in the USA versus Turkey, with real numbers, real comparisons, and the reasons why so many Americans are choosing to fly overseas for medical care. Let's start with a simple example, something very common: rhinoplasty, or a nose job. In the US, the average cost of rhinoplasty ranges between $9,000 and $15,000. That usually includes the surgeon's fee, anesthesia, operating room charges, and a short follow-up. But that's about it. In Turkey, that same rhinoplasty costs around $2,500, and that includes everything. I'm talking about pre-surgery blood work, the surgery itself, general anesthesia, post-op care, medications, and even hotel and airport transfers in many cases. That's a base savings of up to 80%. Let's look at another one: dental implants. In the US, a single dental implant costs around $3,000 to $4,500 per tooth. That doesn't include bone grafts, sinus lifts, or crowns, which can bring the total up to $6,000 plus per implant. In Turkey, the full procedure, implant, abutment, and zirconium crown, usually costs around $500 to $700. Some packages even offer full mouth restorations, all on 4 or all on 6, for under $5,000 total. We're not talking about back alley clinics either. These are modern dental centers using brands like Straumann, Nobel Biocare, and Astra. What about hair transplants? In the US, a hair transplant costs around $8,000 to $15,000 depending on the number of grafts. In Turkey, the average cost is between $1,500 and $2,500, and that often includes 3 nights in a hotel, VIP airport transfers, aftercare kits, and full PRP therapy. Why is there such a big difference? Let's talk about what drives up healthcare costs in the US. High malpractice insurance for doctors, overhead costs in hospitals and clinics, administrative costs and billing bureaucracy, a lack of pricing transparency, the influence of private insurance companies, extremely high labor costs, and, of course, profit-driven healthcare systems. Now, let's contrast that with Turkey. Turkey's medical system, especially the private sector, operates on a more streamlined model. Labor is cheaper. The cost of medical equipment is lower due to local manufacturing. The Turkish lira's exchange rate makes services more affordable for foreigners. And most importantly, the government actively promotes health tourism with incentives, tax breaks, and infrastructure support. But low cost doesn't mean low quality. Turkey has over 50 JCI-accredited hospitals. That's more than most European countries. Many Turkish doctors train internationally, speak English fluently, and specialize in fields like plastic surgery, orthopedics, bariatrics, and dentistry. Hospitals use the same brands of implants, machines, and tools that are used in the US. Let's do a few more comparisons, just to give you a wider picture. USA, $600 to $1,200. Turkey, $150 to $250. $1,000 to $1,500. So now the real question is, what are you paying for in the US? Because clearly, you're not always paying for better. You're often paying for more expensive. Of course, not everything is about price. When it comes to surgery, safety and quality are non-negotiable. So let's talk briefly about how to compare clinics between the two countries. In the US, clinics are regulated by national boards and state laws. In Turkey, the private health sector is monitored by the Ministry of Health, which conducts inspections and requires certification for medical tourism facilities. Many of the best clinics in Istanbul, Ankara, Antalya, and Izmir are accredited by international organizations like the JCI ISO or TEMOS. Plus, thanks to competition, many Turkish clinics go above and beyond with their services. Things like 24/7 coordinators, multilingual staff, luxury recovery suites, chauffeur service, and lifetime follow-ups. These extras are often included in the price. Meanwhile, in the US, you might pay thousands just for a 20-minute consultation, and then get billed again for anesthesia, for blood tests, for hospital gowns, even for using the operating room. That's not a joke. It's a broken system. Now, just to be fair, Turkey isn't perfect. You need to do your research. Some clinics are better than others. Some are heavily advertised online but don't have the best track records. It's important to look for independent reviews, verified patient testimonials, certifications, and before/after photos. But when you compare price and quality side by side, it's easy to see why more than 1.5 million people traveled to Turkey for healthcare in 2023. That number is expected to rise to nearly 2 million in 2025. Let's wrap this up with a simple visual recap. Procedure: USA, AVG cost; Turkey, AVG cost. Savings: Neşmeli Sur. Rhinoplasty, $12,000, $2,500, 80%. Dental implant, $3,500, $600, 83%. Hair transplant, $10,000, $2,000, 80%. Gastric sleeve, $22,000, $4,000, 82%. LASIK, both eyes, $4,500, $1,200, 73%. Hip replacement, $45,000, $11,000, 75%. If you're paying for your procedure out of pocket, or even if you have insurance, but the deductibles are sky high, Turkey might be a smarter, safer, and surprisingly luxurious option. So the next time someone says, "You get what you pay for," remember, sometimes what you're paying for is just overpriced. And in the case of Turkey versus the USA, the numbers speak for themselves.